In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
I'm with Dr. Richard Stern here at the Schlossberg Clinic in Berlin. He's the chief cardiologist and he's the chief of the checkup clinic. Thanks for inviting me today. We just saw that men don't go that often to checkup examinations like women do. How often do you see men here?
So our clients are, let's say, half-half. But generally speaking, men don't like to go to the doctors very early in their life because to be sick, it's not masculine. So that's why they get their heart attacks earlier than women and die 6 or 7 years earlier than women do.
So I'm a man, I would like to go to a checkup clinic, so I come to your place here. So what would you do with me?
First I say you're welcome in the Schlossberg Clinic. And we have here a basic program for general internal medicine, where we check the patient concerning his risico profile, blood tests, ultrasound of the abdomen, of the heart, of the carotid artery, functional tests with like ECG or stress tests. This is a basic program, and then we have a premium program concerning of your needs, individual needs, like a CT of the coronary arteries if it's indicated.
And your needs mean your wishes? So if I wish to go through the CT scanner, you would do this? Or is it more like that there are medical needs for me to go through this kind of scanner?
It will be a combination.
Okay. Because
it's depending on if you want to have a life insurance and you want to be very sure of your risk score, you will say, okay, you know what, I have a bad genetics, I want to see my calc score. Yeah. So make me a CT because I want to be sure that it's everything okay.
This is a calcification score, that there's calcification inside the coronary arteries.
Inside the coronary arteries. Right. So well, we can decide if somebody has a very high risk to get, due to his hypercholesterolemia, an early heart attack, and we have to prescribe a medicine like a statin to lower the cholesterol levels.
Right. So in your clinic there are a lot of specialties. There's a neurology specialty, there's a gastroenterology, and you're the cardiologist. So in your field of practice, what are the specific tests you're doing in the checkup?
There is echocardiography of the heart, just without exercising, just laying. But if I want to know if somebody has a high risk, have coronary calcifications, and I want to know if the supply of the heart with blood is okay, I make a stress test on ECG or with my echo. And this is a possibility to...
Stress test means you're putting the patient on a treadmill, for instance.
We'll show it after that on a bicycle, and we can measure the heart with our ECG, or with the echo, it's ultrasound of the heart, and just to look if the walls of the heart get enough blood supply during exercise.
And if you find anything, it's not just that you put it into the file of the patient and say he's got a thick arterial wall, you would do a therapy then.
Yeah. So first, those guys who are coming here are first our clients. They are not patients because they are not sick. But if anybody has high blood pressure or higher cholesterol or has a heart problem, they get to patients and they get a specific therapy, medication for blood pressure, medication for like aspirin to avoid a heart attack, or medication against high cholesterol levels.
So preventive medicine can save lives. Thank you, Dr. Stern, for inviting me today into your checkup center.